Good evening and welcome to SVG-TV News for Thursday, August 12th, 2021. I am Rochelle Batiste with the details. The Ministry of National Mobilization and the Ministry of Agriculture, in collaboration with the Community Disaster Risk Fund, the UWI Seismic Research Center, and the Food and Agriculture Organization of the United Nations, today launched the Community Profiles and Livelihood Baseline Assessments. The launching ceremony took place at the Beachcombers Hotel under the theme Inclusive Community Development and Building Resilience. The livelihood baseline assessments have been executed in 12 communities across SVG, giving persons of all age group the opportunity to discuss, identify, and agree on issues which affect them. The assessments also help to identify the hazards that the communities are exposed to, along with the potential impact, both short and long term, on livelihood. The assessment started under the Volcano Ready project in 2017. Speaking at the launching ceremony, Senior Assistant Secretary of the Ministry of National Mobilization, Lafleur Kwame Harry, explained how the information was gathered for the assessment's report.
The information contained within these reports were gathered from 11 communities from both the leeward and windward sides of the island. We did in Fancy, Oria, Sandy Bay, Overland Magum, Connery, Park Hill, South Rivers, Spring Village, Rose Hall, Chateaubelair, and Fitzhughes. And this assessment was conducted over a period of 2 days by a combined group of staff from the Ministry of National Mobilization and NEMO with the use of the COBO toolbox.
Kwame Harry said the purpose and use of the completed documents will be vitally important to guide the Ministry of National Mobilization in the country's recovery plan.
That these documents provide a roadmap in several vital areas. Firstly, in the area of community development, the importance of community profiling cannot be overstated, as by doing these profiles, a complete as possible picture of the communities emerges. Having this clear picture would go a very long way to allow for targeted interventions, both in terms of disaster recovery or just general interventions. In terms of disaster recovery, by providing a clear picture of what an affected community was like pre-disaster, relief agencies such as the Ministry of National Mobilization, NEMO, and even our international partners can provide targeted assistance and can also know the cost of such interventions.
Kwame Harry further expressed gratitude to all parties involved in the collection of data and compiling the documents for the assessment.
I'd like to express the direct gratitude on behalf of the Ministry and the Government of St. Vincent and the Grenadines by extension to all parties involved in the collection, compilation, and production of these documents: the Social Development Commission of Jamaica, the Caribbean Development Bank, the Food and Agricultural Organization, the University of the West Indies, NEMO, the Ministry of Agriculture, and of course, all community residents who gave of their time to provide the needed information. I reaffirm our ministry's commitment and assurances that these current documents and others to be produced would not just be piled on a shelf, but will be used for the benefit of the communities and the overall development of St. Vincent and the Grenadines.
At the end of the process, the report from the assessment will be put in hard copy format to be made available to the public. In other news, following a major protest action last Thursday outside Parliament against amendments to the Public Health Act, infectious disease specialist and advisor to SVG's COVID-19 task force, Dr. Gerald Thompson, said the amendments are being misinterpreted by a number of persons. In a telephone interview with SVGTV News, Dr. Thompson said whilst the act does not make vaccination mandatory, it encourages frontline workers to be vaccinated or to to get tested in the absence of inoculation against COVID-19.
The Act does not introduce mandatory vaccination for COVID-19. What it stipulates is that frontline persons are encouraged to be vaccinated. That is for a situation of their own risk. But if it is their choice not to be vaccinated, then they should be tested. And there are some amendments that in the past the Public Service Act gave them free tests at the Milton Cato Hospital only. So this has been amended. They could be tested at many of the other clinics and polyclinics. But the important thing is that they must be tested so as to pick up any incident of a positive test early, so that the healthcare worker or the policeman doesn't pass it on to their colleagues or to a patient, because in hospitals and clinics, that's where sick patients are.
Dr. Thompson detailed the changes that were made to the language within the Act, highlighting that there is no intention to make the COVID-19 vaccine mandatory here in SVG.
They just remove the word voluntary. But and what that does, it protects the childhood vaccination, in which persons do have to get vaccination to go to school. It protects that from anybody interpreting that that is also voluntary. You understand? And in terms of the COVID-19, there's no intention to make that voluntary. So as voluntary has been taken out, mandatory has not been inserted.
The infectious disease specialist advised concerned Vincentians to read for themselves what the Act entails so that they will gain a better understanding for what the amendments stipulate.
It is probably to read the Act themselves and also to get a much deeper explanation of what it is. When persons say that the Act now makes it mandatory for everybody throughout the country, that is not true. And in terms of if it is considered mandatory for frontline workers, policemen and healthcare workers, that is also not true. It is just that they are the ones who are going to be most exposed to the public. And we want to not only protect them, but we also want to protect the public from anybody who's a healthcare worker, policeman become positive. That will happen, that has happened, and we basically want to make sure that they don't pass it on as a super spreader to any of these persons.
Dr. Thompson also noted the ground on which persons can be granted an exemption from COVID-19 vaccination with the amendments.
Individuals could also have an exemption on medical grounds only. For this, they would have to have a doctor to write them that particular exemption. Now, there are some known medical conditions which persons can be exempt, and the doctor would typically write one of those. However, if the doctor seems to be writing hundreds or thousands of exemptions for conditions that don't really provide exemption or may not be true, then those things will be looked into by the medical officer of health. And in addition, the CMO may appoint a committee for other doctors to really look at the diagnosis to see if it is. In other words, if the patient doesn't really have that condition, because a physician is writing it for them, just like a sick note may be written, then that's something that will be reviewed.
Meanwhile, President of the SVG Teachers Union, Oswald Robinson, has written Governor General Dame Susan Duggan requesting that Her Excellency decline or halt giving assent to the amendments of the Public Health Act, which were tabled and approved by Parliament last Thursday, August 5, 2021. In the letter dated August 10, 2021, the SVGTU President asked for the Governor General's intervention on behalf of the more than 1,400 members of the Union. The sections of the Act that the Union wants the Governor General's intervention are 27B, 43B of the Public Health Act, Chapter 300, and the Medical Officers Act, Chapter 292. 5 reasons have been listed by the Teachers Union president why the Governor General should not assent to the Public Health Act, which include the balancing of competing rights and the ethical guidance provided by the World Health Organization for governments and policymakers not to make the vaccines mandatory. The union said the government also failed or refused to engage stakeholders in effective and productive dialogue, noting that it has been more than 2 months that the government has promised to provide the unions with a clear policy on the COVID-19 protocol and vaccine, and it has not done so. The union head further added in its letter to the Governor General that a collaborative, meaningful, rather than a coercive, threatening approach is the best practice approach, especially in these critical times, noting that the data and information about the SARS-CoV-2 and vaccines is constantly evolving, and it is indisputable that no one knows the long-term effects on humans, noting that everyone has a duty and obligation to be good, conscientious citizens. The SVGTU president said while they recognize the challenges of the times, with good faith they seek the best approaches and outcome for not only their members but all Vincentians, and asks their request from Her Excellency is received with equally good faith and given conscientious consideration. Meanwhile, as SVG continues to receive doses of different COVID-19 vaccine, an increase in the inoculation rate on ground is being anticipated. This is according to advisor to the COVID-19 task force, Dr. Gerald Thompson. Dr. Thompson said the country recently received 118 doses of the Pfizer vaccine, and all of the doses were fully utilized, some being administered to eligible children at the request of their parents or guardians. Dr. Thompson said as more Pfizer vaccines become available, COVID-19 vaccinations among children are expected to increase here.
We have AstraZeneca, we have Sputnik, we had a small dose of Pfizer on the ground recently, a donation to the police force, and they were all utilized. Every single one of the Pfizer vaccines was administered, especially to children. And what we're going to see is that a number of families will want their children vaccinated because the Pfizer has been approved for kids from the age of 12 to 15. And in terms of going back to school, where people can be concentrated in the school, we're now seeing this. Now, the Delta virus seems to be affecting children more than what the older strains would have done. I am not trying to make people frightened. I'm saying these are facts. And what we are seeing in Florida, the pediatric intensive care units are full. So we have to take heed. And I believe that we will see a spike in the childhood vaccination rate as we get the Pfizer vaccine coming in.
The infectious disease specialist said it is expected that the Pfizer and Moderna vaccines will be granted full approval soon, noting that these vaccines will no longer be considered as ongoing experimental vaccines.
Pfizer vaccine and probably the Moderna vaccine by the end of this month might well have full approval. The emergency medical approval, in my view, doesn't place Pfizer or Moderna as being experimental. And in terms of other countries, they have different systems. They're not under the FDA and don't require FDA approval. They're approved in their own jurisdiction. And we have approved them basically in ours. And they are not to be considered as ongoing experimental vaccines. They are protective. They're highly protective. They will reduce transmission. And even though the Delta virus is challenging that whole concept of being protective and transmission, in terms of hospitalization and death, the Pfizer, the various vaccines, Sputnik, AstraZeneca, Pfizer, all prevent hospitalization and death to a significant degree.
And one new COVID-19 positive case was reported from 175 samples processed on Tuesday, August 10th, resulting in a positivity rate of 0.6%. 8 new recoveries were noted over the reporting period. 43 cases are currently active and 12 persons with COVID-19 have died. 2,307 cases of COVID-19 and 2,252 recoveries have been recorded in SVG since March 2020. The health authorities say in view of the increased risk of infection with and subsequent transmission of COVID-19 posed by the growing incidence of variants of concern in persons entering SVG, strict compliance with all protocols and recommendations, including the effective use of masks, physical distancing, hand sanitizing, and immunization with the available vaccines is strongly recommended. In other news, parliamentarians have a right to unhindered access to go and come from the House of Assembly under the Public Order Act and the House of Assembly Privilege and Immunity Act Section 25. This has been pointed out by Prime Minister Dr. Ralph Gonsalves on VC3 last evening, where he was discussing what occurred on August 5th before he was injured in the protest action outside the Parliament building. PM Gonsalves explains that if any stranger assaults or hinders any member of Parliament from going to Parliament, he or she can be fined up to $1,500 and 6 months in prison.
Stranger who assaults, hinders, obstructs, or insults any member, that is to say, an elected representative, senator, or the Speaker of the House, coming to, going from, or being within the House, or the precincts of the House. You notice? If you assault me, you hinder me, you obstruct me, or you insult me, going to the House, it's an offense, punishable by a fine of up to $1,500 and 6 months imprisonment. And then any stranger who creates, who creates or joins in any disturbance which interrupts or is liable to interrupt the proceedings of the House while it is sitting, is also guilty of an offense to pay up to $1,500 and go to jail for 6 months.
The Prime Minister said a number of persons are not aware of the law. However, he noted ignorance of the law is no excuse for a person's action.
And this law has been on the books for years. The last time it was amended was 1987. We haven't touched it during my years in government. And you have persons thinking they can just curse and abuse you, stink, make a whole heap of noise, disturb the Parliament, hinder you, assault you, batter you, bust your head, give you a concussion, let your blood flow. And then you have NDP people, including people in the leadership, say, it's my fault? My fault to exercise my right and to go to the Parliament which I'm elected to?
Speaking about the provision under the Public Order Act that gives the police officers the power to move protesters within a radius of 200 yards from the perimeter of the Parliament building, the Prime Minister said if persons refuse to move, they can be charged with an offense.
The police is empowered to say, move, disperse. And if you don't, it's a criminal offense, punishable by fine and by imprisonment. But what has happened over the years, people have been, anybody who gathered there, they've been fairly good-natured. And the provision had never been enforced very strictly. Of course, the police may well do differently now that somebody bust the head of the Prime Minister, and not only that, the general bad behavior, what you had on that day. And the bad behavior has been increasing since 2015. We saw it against the supervisor of elections, and we saw it in front of the parliament, but it has gotten worse since 2020.
Meanwhile, the RSVG police force has signaled its intention to enforce the Public Order Act. In a news release today, it was noted that at a meeting of the gazetted officers of the Royal St. Vincent and Grenadines Police Force on Friday, August 6, 2021, it was concluded that purportedly peaceful protests have become less and less peaceful, and reminded members of the active political parties, trade unions, and the public at large of the Public Order Act Chapter 396, encouraging everyone to abide by the laws, and in this case, the Public Order Act Chapter 396. The RSVG Police Force extends an invitation to the political parties, trade unions, and the public to visit the office of the Commission of Police if there is need for conversation and clarification on the matter. The police said it will strictly and responsibly enforce the Act and other laws of SVG. Meanwhile, in an interview with SVGTV News yesterday, lawyer K. Bacchus Batiste is of the view that the commissioner is seeking to use the Public Order Act in an attempt to stop protest action in the country. More local news when we return. Stay with us. Welcome back. The Eastern Caribbean Central Bank, the ECCB digital currency or D-Cash, was launched here in SVG today, August 12, 2021. At the virtual launch and ceremony, Minister of Finance Camilo Gonzalez celebrated the introduction of the digital form of the EC dollar in SVG. Minister Gonzalez noted that as a multi-island state, moving money around digitally is a safer and more convenient for citizens. Also, it makes conducting business and accounting easier for both buyers and sellers. The finance minister noted that the uses of the digital currency are endless, the utility obvious, and the software seamless. He encouraged the early adoption of D-Cash in SVG by the business sector in order to facilitate the general uses of the digital currency and encourage the move away from physical cash.
We're encouraging every single merchant in St. Vincent and the Grenadines to sign up, get yourselves a merchant account with D-Cash so that someone can come to your restaurant and buy food with D-Cash, or come to your clothing store and buy clothing with D-Cash, or whatever the services are, and they can just transfer money to you. It takes 3 seconds for money to leave your digital wallet and go into somebody else's digital wallet. It's very, very important that merchants and banks adopt D-Cash early. Once we have that early adoption, it's going to be relatively simple to get everybody else in St. Vincent and the Grenadines to download the D-Cash app and do work. But if it's inconvenient, if there are very few people doing it, very few people using it, it's not going to make any real headway in moving St. Vincent and the Grenadines away from the challenges that we face.
Also speaking at the launching ceremony was Governor of the Eastern Caribbean Central Bank, Dr. Timothy Antoine, who detailed some of the motivating factors behind the launch of D-Cash.
We at ECCB are in our 38th year, 38 of existence. Payments are the lifeblood of every economy. And at the ECCB, we truly believe that the payment system should work for all except illicit actors. As we speak, that is not the case. We have heard, we have listened, and we are keenly aware of the frictions that many of our citizens and residents face when it comes to transacting, doing business, making payments in our currency union. Whether that is because the payments are too expensive, whether it's because they're too slow, or whether they're just too many hoops to go through. We are mindful, for example, of the difficulty with opening a bank account, and that is why in the design of D-Cash, we have made it possible for persons who do not have a bank account to be able to use D-Cash and to have a D-Cash wallet. That's our value-based wallet. We have two types, the registered base, if you have a bank or credit union account that is participating, and the value-based if you do not have a bank account or credit union account. Because at the heart of this innovation is financial inclusion and empowerment.
Dr. Antoine also noted the compelling reasons for the use of D-Cash and SVG as the ECCB continues to build a digital economy in the region.
For us at the Central Bank, this is part of the motivation for D-Cash. You have faced very difficult circumstances. All of us are in the pandemic, but you have had to deal with a volcano as well. And as you build back and build back better, you need to build with resilience. And we believe that Dcash brings an additional tool, puts that additional tool at your disposal to build back with resilience, to modernize the Vincentian economy, and to give people more opportunities to advance. And we're very clear, as we build out a digital economy, we, our people, have to be active participants in that digital economy. Not just as consumers, but as producers in that digital economy. If we build it out and you cannot participate, our efforts are futile and are in vain. We don't want to do that. And so I want you to understand, situate this innovation that is Dcash. This is not simply about technology. This is about you, empowering you, giving you choice, giving you convenience, and enabling you to be an active participant producer in the digital economy.
Dcash now at the Royal Bank of Trinidad and Tobago. The ECCB is currently working with other financial institutions on ground to have them Dcash ready in the coming weeks. In other news, we hear that there has been a slight increase in motor vehicle accidents for the first half of this year from January to June. This is according to Inspector of Police Panel Brown, who is second in charge of the traffic department.
In 2020, we had 144 reported motor vehicle accidents from January to June, and compared to 203 for the same period in 2021. While there was an increase in the amount of accidents reported, it was not something of a significant amount, but we had a general increase of accidents reported around that time.
Inspector Brown further noted that while for the first half of 2020, 28 persons suffered injuries due to motor vehicle accidents, they have seen an increase for the first half of the year.
From January to June of 2020, we have 28 accidents reported with injuries and 116 without injuries. When compared to the same period of 2021, we had 48 accidents reported with injuries and 155 without injuries. There was a slight increase for the period in 2021. We at the Traffic Department, we will continue to educate and inform our drivers as to how they can make themselves and other persons using the road safe.
2 road fatalities have been recorded for the year thus far. The first victim was Belair resident Shavil Kane, who died on the Mandela Highway on July 18th, and the second victim, a 15-year-old student who died this week on the road leading to the Mineral Spa in Belair. The traffic corps encourages motorists and pedestrians to be considerate to all road users.
Give adequate warning and signal of your intended direction in time to enable other persons behind and in front of you to know of your intended direction. That other person you extend courtesy. Be patient with other persons who are using the road. Every driver on the road does not have the same ability to drive and to maneuver a vehicle the same way in which you might want them to. Hence, you have to exercise some level of caution to other persons.
Inspector Brown is also asking that persons report to the police or the traffic department any obstruction that they might observe on the road which can cause road hazards.
Any obstruction you might be observing on the road and it is not brought to the attention of the police, I'm asking you please to bring it to the attention of the police where there is a derelict vehicle, where there is sand being placed in position where it might cause obstruction and inconvenience to the person who's using the road. I'm asking you to not take matters into your own hands. Report it to the police in your district. If you have reported it to the police in your district and there isn't any action being taken, you can report it to the traffic department. We will ensure that the necessary action have been taken to ensure that the roads of St. Vincent and the Grenadines continue to be safe for everyone.
For the first time, residents of the Grenadine Island of Union Island will be able to gain training in 2 CVQ Level 2 courses under the Youth and Adult Training for Employment (YATE) program as part of the Human Development Service Delivery Project. The courses include bar service or bartending and food and beverage service or restaurant service. The courses are expected to help residents improve individual skills, leading to Level 2 certification. The training begins on Monday, August 23rd, 2021. YATE is currently undergoing the training of Cohort 4, which officially started June 3rd, 2021. 479 persons were trained and 227 youth certified in different technical and vocational areas. The government of St. Vincent and the Grenadines has received funding from the World Bank for the implementation of the Human Development Service Delivery Project, which is designed to strengthen the quality of service delivery in education, improve the efficiency of social protection systems, and improve the effectiveness of labor market systems.